Down syndrome. What is Down syndrome? It is a disorder caused by a defect in chromosome 21, which someone receives either partial or an extra chromosome, and it causes physical abnormalities and mental impairments. What are the odds of being affected with this disorder? Women that already have a child with Down syndrome have a 1 in 100 chance of having another. Regular women having a baby at a healthy age have a 1 in 200 chance. Is it a chromosome problem? Yes, Down syndrome is a chromosome problem. It is the addition of a partial or full chromosome 21.
Is it caused by a mutation to a gene? If so, what is the mutation? Down syndrome is caused by a chromosomal abnormality in chromosome 21, not a mutation to a gene. Does it affect one ethnic group or sex more than the other? If so, which, and are there any specific testing procedures? Down syndrome does not affect one ethnic group or sex more than the other. What are the signs or symptoms of the disorder? Some of the symptoms and signs of Down syndrome are flattened facial features, small head, short neck, protruding tongue, small ears, and brush field spots.
What are the tests used to check for Down syndrome? Screening tests. Many screening tests can help identify whether you have a high risk of carrying a baby with Down syndrome, but they can't identify whether your baby has Down syndrome. Cell-free fetal DNA analysis. This test checks for fetal DNA circulating in the pregnant mother's blood. This test usually recommended for women who have high risk of having a baby with Down syndrome or in response to risk detected by one of the previous tests. What are some treatment options? Medical treatment. Medications. Medications are used to treat some conditions accompanied by Down syndrome. Medical and other specialists. Pediatricians are main healthcare professionals who treat his or her medical issues. Therapy. Physical therapy. Physical therapists teach children with Down syndrome that have hypotonia, low muscle tone, how to move their bodies in appropriate ways, and they also help improve their muscle tone. Speech therapy. Speech therapists teach children with Down syndrome to communicate more clearly through talking or sign language. How does it affect the person's life? Life. Down syndrome can have many effects on a person's life. There is a 50% chance that the person will have heart defects, causing them to tire easily. Children with Down syndrome often have digestion issues. Their intestines narrow down, which can be restricting to weight gain. Prognosis. Although the prognosis of people with Down syndrome depends on the severity of the medical problem, it has improved over many years. In 1910, the life expectancy of a Down child was 9 years of age. Thanks to improvements on medical technology and early intervention, studies have shown that 80% of people with Down syndrome live up to be age 55, and many live even longer.